Gan, hi everybody. I would like to know. My friend met.
Your name?
I'm Suin.
Hi, Suin. Welcome. You're from
Malaysia.
Malaysia. Okay. Hi, Suin. You can please ask what questions do you have?
My friend is wearing a stainless steel pacemaker, permanent pacemaker. Can he take this terahertz water?
That situation is a bit complicated. On the paper, people say we cannot use pellet water. However, through my so many years of research, and I also deal with a lot of patients have the pacemaker, and I teach them flow technology. For my understanding, this water has no reason to stop you from all this healing, but you need to be very, very careful when you drink a small amounts, starting from 500 ml, then slowly increase to 1 liter, 1.5, 2 liter. You need to keep drinking and see the result and test whether the heart pace is more faster, and many other signals you need to take note. You drink like you drink 500 ml for 3 days, then 3 days later increase to 1 liter, then 3 days later increase to 1.5 liter. So with such a control manner, so it could be very, very safe for you.
Hi, Suin. Did Dr. Gan answer your questions?
Because the slang I can't some can he repeat again?
Okay, what he said.
I mean your friend feel free for your friend to use the water, but in a controlled manner. Means you start with 500 ml, slowly increase 1 liter, closely monitor the health. Okay.
The first day 500 and then increase to
for first 3 days 500 ml, then the second 3 days 1 liter, then 3 days later 1.5 liter, slowly increase.
Okay.
You need to check the body energy and many other parameter. Okay.
How to check the what you said to monitor his or what need to check?
You ask the medical doctor to help him.
Oh, I see. After 3 days, then have to go to the medical doctor.
Yeah.
Every 3 days, okay. Thank
you.
Thank you, doctor.
You're welcome. Any other sharing? You're welcome.
Doctors, I'm Dr. Low here. I'm an architect actually. I want to check with you. These waters, we use plastic when we do the terahertz. Any other container you can use? Has to be, of course, I think plastic and glass. How about metals containers? Hello.
Hi, Dr. Gan. Did you hear Dr. Low's question?
Dr. Low, yeah.
Hi, Dr. Gan. I think maybe there is some technical issue. Let me get him first. Hold on. Please hold on a while, everyone.
Okay, thank you.
Hi, Dr. Gan. Are you able to hear us, Dr. Gan? Dr. Gan.
Yes. Sorry, my line is off.
Yeah. Did you hear Dr. Low's question? He was asking, that other than the plastic container, glass or ceramic, can we use metal to resonate?
Metal.
Container.
Metal?
Yes.
Yes.
No,
yes.
no, I don't suggest to use metal heavily to store the toilet water. But for short time, it should be okay. Like you want to heat up the water, use kettle. Yeah, that's all right. That's all, no problem. But don't store the toilet water after resonating. Store in the metal container.
Okay, Dr. Lo, did you hear Dr. Gan's explanation? Are you okay?
Yes.
Dr. Gan, there's a few questions in the chat. Okay. Let me see. What are the type of utensils suitable for the terahertz water? Which just now you answer. We say that we are using plastic, ceramic, or glass. But for metal, we are or steel, we are not advisable, right?
Yeah.
The next question is. Let me see, what's the next question? Water is antioxidant. Water is antioxidant. Will it reduce the efficiency of the medication as medicines are typically free radical? Hello, Dr. Gan. Means the water is antioxidant. Will you reduce the efficiency of the medicine they are taking? Typically, medicine.
No, never. It will enhance. It will enhance the taking the medicine. So this water helps you whatever medicine to be very effectively.
Okay. Chin, I hope Lo Chin, I hope that Dr. Gan have answered your questions.
Further questions. When we are cooking, with a wok, and other metal containers, then it means that we cannot put we cannot use the terahertz water then.
No, just within a half day it should be okay, but don't put it
not too long
into the metal container too long.
Okay. Another thing is I noticed that after I do the resonating, I put the device onto the cloth. The wrapping cloth that comes together with the devices. I put it on top of that, but eventually I take it out. You can see that the cloth, some material change happened to the cloth. I'm not sure anybody has tried that. I don't know, it get thinner.
You mean the cloth the color change?
Yes, slightly, and it become thinner. Immediately when you do the resonating, so I'm worried that some vapor may have gone into the holes at the bottom. So I put it onto the cloth, and but I took it out. I discovered that you can see some changes to the cloth, material change, and it become thinner also.
So So are you saying you are opening the device and put directly on the top of the cloth?
Yes, the cloth, where we wrap the device.
No, so your device is on, right?
No, off.
Your device is off. There's no reason for the cloth to change anything.
Yes, no, you see what I have discovered is like this. After resonating, I turn it off. I take down the device, I put it onto the, you know, the cloth that comes together with the device, and where we put it, where we keep the device, I just put it on top. And because I just want, in case there is any moisture go into the bottom of the device and the holes, so I just put it there. And after a while, you know, I take it out. The cloth material actually has some changes, you know. Because you know, the wrapping cloth that comes with it actually is brown color, and it becomes whitish, and it becomes thinner, you know. I'm not sure why. What is the reaction there actually?
I have no idea at all, because the device is off.
Yeah, it's off. Yes, exactly, it's off. Yeah.
Yeah, maybe purely due to friction between your device and the cloth.
Yeah, that is what I guess. It may have been bleached, you know. Yeah.
Yeah.
It may have been bleached. Yeah. Okay. Yeah. Okay. Another thing is, can you put the device, you know, like some patient was saying that they put it over their eyes, you know, where they have cataract, you know, you can put it onto the any body parts, you know, with the machine.
No. That's very dangerous. Okay, don't put the device onto your. Don't put the device onto any of your body parts.
Okay. Yeah. Because I would presume so, you know, actually. Yeah. So I think I hope that the some of the leaders up there, you know, wouldn't advise people doing that. Yeah. Because I think those are actually radiation, you know.
Yes.
Okay. Right.
Okay, thank you, Doctor. Dr. Gan, there's a question here. Doctor, you presented that drinking terrace water after 20 minutes, the blood shape will change. If the person drink normal water, is there any experiment to show that drinking normal water will not change the blood shape?
No, that will not change. Normal water will not change.
Okay, then there's another question from Jackie, scientific question. How is the H2O molecule or structure property that can explain the antioxidant property in the water after the after scan with the water device?
So basically, you look at the hydrogen-oxygen bond. We have 2 hydrogen, 1 oxygen, right? So H2O, right? H2O is 2 hydrogen, 1 oxygen. So hydrogen-oxygen bond, this bond, they form a molecule with the bonding structure, bonding angle. The bonding angle is 104.5 degree. After resolution, the bond angle will increase by 3 to 5 degree. 3 to 5 degrees. So it becomes 107.5 and 109.5. So in between. So this particular structure makes the water has a strong antioxidant structure, antioxidant property, and also can explain with this structure change, it can explain that why our water can last for 6 to 8 months, and also can explain why our water after boiling the property doesn't change. So all these are very good scientific evidence, but not many people dig deep enough to understand all this. But luckily I am a scientific engineer. I study all this, so I understand what happened, what make our water so special, to show many good characteristics. I hope you understand, you appreciate.
Okay, then there's another question that how long after starting on drinking this water, the diabetic condition will improve? Sorry.
What do you mean?
How long after starting on drinking this water, the diabetic condition will improve? Okay, maybe I can help to answer this question because my mom is also a diabetic patient, Sim. How long? It depends on each individual immune system. Like for my mom has been on the 3 high medicine for 30 years, and she has been drinking around 2 to 3 liters of water a day. And I do see her result. Okay, different people, different result. But because my mom is in the age of 70 something, so her sugar level dropped after 6 months. So it depends on individual immune system. And this water does helps her. But other than her diabetic or her sugar level, but it also helps her in a way. We do every 3 months a check. And the result for her kidney was functioning much better. That's all I can share. Thank you. I hope answer your questions. Dr. Gan, there's another question. Is this water similar to hydrogen water?
First of all, I would like to say there's huge difference between hydrogen water and this water. First of all, hydrogen water never show you how much viscosity it will reduce after hydrogen water. It never show you how much is half width of the NMR peak. This one doesn't show you the molecular size of the hydrogen water. Furthermore, for hydrogen water, you cannot use it after 10 hours to 15 hours. So after some time, hydrogen water become not effective at all. However, our water shows after resonating, the viscosity drops by 680 times, and also shows that the half width of the NMR peak is 7.6 Hertz. Furthermore, it can last up to 8 months, doesn't matter. So these are all the huge difference with hydrogen water. Furthermore, hydrogen water is a technology from 10 years or maybe 20 years ago. However, our terrace water technology is only 3 years ago. So that is the latest technology. Yeah, you have to understand clearly.
Okay, hope Dr. Gan has answered JY's questions. The other question from KC Chin, Doctor, is your experience with terahertz water how long? How many days, weeks, or month does it take for the blood pressure to go lower after taking the terahertz water? Also, how much to drink to effectively reduce the blood pressure?
Okay, so in order to achieve the reduction of the blood pressure, we have to be very careful and start to drinking the water from 500 ml up to 3 liter, and even 3 to 5 liter is also possible. So the time you expect the blood pressure reduce normally can be 2 to 3 months. Some people took even longer, half a year is also possible.
As spoken, Chin is regarding it depends on every individual immune system. Okay, Chin, like I said, for my mom who has been on medication for 6 months and due to her age, so her drinking of the water is about 2 to 3. So that's 2 to 3 liters. That's why it depends on individual how fast you will see the effect. I also have clients that have drink the water and within a month they see their pressure already lowered down. So it really depends on your age, on your immune system, and how you drink the water. Okay, Chin, thank you. Okay, Dr. Dr. Gan, there are a few more questions here. Water can be classified as hard and soft water. Is there any difference if we scan this type of water? Dr. Gan?
Yeah, so basically the hard water and soft water after regulating, this water will not change the structure of the hard water, cannot change the hard water into soft water. Also, in another way, cannot change soft water to be hard water. The hard water is still hard water, okay, after the resolution, okay? So basically, like you have pH value, this terahertz device can never change your pH value.
Okay, Ms. Ng, I hope doctor have answered your hard and soft water question. There's a question from Francis. Is there any critical paper written on the goodness of terahertz water?
Yeah, that part is a bit tricky, and clinical benefit of the terahertz water is ongoing study. And China, they have a lot, but is in Chinese.
Okay, the other question is from Elaine. Doctor, for autism child, what is the suggested amount of terahertz water to consume for a start?
Yeah, you can start with 500 ml, then slowly increase by 1 liter, 1.5 liter. So for autism kids, if the age is above 10 years old, so you target to drink 3 liter, and even much better if he can take it, you try to drink 3 to 5 liter. That will help a lot.
Okay, Eileen, I hope this does answer your question. There's a question that I missed just now from Stan Chu. Stem cell which have the potential to grow into a variety of heart cell types could potentially repair and regenerate damaged heart tissue. With this kind of treatment, whether can they drink terahertz water, doctor?
Yeah, I think for this case, you need to refer to the medical doctor, because the stem cell application into the body, I also don't know how long the time take and what's the exact recipe for the stem cell. So in this case, I have no suggestion to you, because I don't understand the full situation.
Yes, I'd like to inform everybody that Dr. Gan is a PhD for material science. So scientifically, if you want to know anything that's related to science, to water, yeah, we can answer you. But if anything that is regarding your health, please seek your doctor's advice. Okay, thank you. Any other question, or is there anybody that would like to share your testimony? Hi, any other questions? Oh, okay, from Zoe. How do we know that the terahertz water is processed? Is processed in every bottle. Any water tester for this? Doctor?
How do we know the terahertz water is processed in every bottle? What do you mean? I don't understand this one.
I think what he's asking that how do we know whether the water has been processed, has been resonated? So is
there's no way to understand the water is being processed or not, because the change of the viscosity happens so fantastically. You have no way to test of course, you can easy way to check the water is processed or not. You can use a muscle test. Muscle test is a very effective way of testing the water is resonated or not. But you must have enough experience.
Okay, Joe, what I can share with you is okay, for those who have actually drink our water, their experience is actually when they drink our water, they can feel that the water that is resonated is very smooth. So after a while, when you get the taste of the smoothness in our water, if that water is not resonated, you would be able to feel that whether it's the water has been processed or resonated. The other way is we use our lemon test, which is we used to I think you can ask the person who introduced you, maybe he can send you a video on the lemon test. Yeah. Okay, there's a question by the, let me see, by Fok Chong. May I ask what is the best kind of water to scan? Alkaline, mineral, RO, diamond, or Amway water? Which is
this is nearly personal preference. Any type of water be scanned by the device, but depends on your purpose. Okay, different kind of water after the scanning. Yeah, they all shows that terahertz water, the basic criteria, basic property of low viscosity, and you can do the muscle test. However, different water, they will inherit different property, like our water inside no minerals. Everybody knows it. And your diamond water, alkaline water, mineral water, they all have different kind of properties. So they are all good candidates for terahertz water to scan. Depends on your purpose.
Okay, Dr. Gan, there's a question. Say, is there any medical science explanation how terahertz water can help reduce blood pressure?
Okay, so terahertz water reduce blood pressure is that the water goes into the brain, goes by the bloodstream, and can reduce the viscosity of the blood, can cause the blood flow smoothly, and no blood thinner more. That's why it's helps a lot to reduce the blood pressure.
Okay, Chin, I hope that answers your question. The next question from Soyin. Can terahertz water help those with mental problems and suggested amount to take for the effective result?
Okay, so it happened to be I have some experience of dealing with a lot of mental issues such as autism, like schizophrenia, epilepsy, and insomnia, everything. And definitely this water contains a lot of negatively charged water inside our brain, because some of the circuits is wrong, and also because there's a lot of traffic, chaotic scenes inside our brain. So also some cells accumulate too much positive charge. So the positive charge also refers to free radicals, right? So all these things will affect our mental issue. So with this water contains a lot of negative charge, the water, so it's going to help a lot for most of the mental issue. It will stabilize the person.
Soin, I hope that Dr. Gan have answered your question. So over here, is there anybody who would like to share your testimony? Come in another question from Lo. Is the effect of terahertz device the same regardless of the type of water under scan? Effective means the one line too low and the 3 NT, all kinds regarding RO, alkaline, minerals, water, etc. After scan, been same effect? Will it be the same effect, Dr. Gan?
Yes, exactly. That's the power of our terahertz water device. Every water shows the basic benefit, basic properties of this terahertz water. and it contains the 5 characters of the water: low viscosity, antibacterial, anti-radiation, anti what? Another one, and also finally
Radiation,
one linear. So you
oxidants.
mentioned one linear, 2 low, and 3 anti-oxidation. Yeah, that's all. That's all apply.
From Francis, is terahertz water good for a sister who have uterus or ovary removal and a harmonia imbalance?
Yeah, that's will help a lot, especially for harmonia imbalance. That's this water is wonderful. Yeah, you are encouraged to try.
Okay, dear all, I hope Dr. Gan has answered all your questions. Or if there is anybody who'd like to share any testimonial, or is there any other questions for Dr. Gan? So if there is no any good result for cancer. Any
Good
good
result. Good result.
Okay, any
Many,
good result
many.
for cancer.
You need to search, but it's not very convenient to share the final result in this public domain. It's very, very sensitive. No. But we do have a lot of good testimonial. You can search out in Telegram.
Will terahertz water affect the probiotic in the intestine since it kills certain bacteria? Dr. Gan?
No, the bacteria have the good bacteria and the bad bacteria. So the water test out our terahertz water only cure the bad bacteria.
I think if there is no more question, we shall end our Zoom for tonight. Is there any other? If no, we shall end the Zoom session for tonight. Yes.
Excuse me. Can I ask a question?
Oh yeah,
Yes.
sure. You are. Please give us your name and where you.
Okay. Okay. I'm calling from Kelantan. My name is Tantian Pan. You know, the source of water, can we get it from underground? Pumping water 30 feet down underground.
Of course, some of the water from underground is very, very special, very, very precious. Yeah, contains high energy inside. It's very good for health.
But then if we do not boil the water after resonating with your terahertz device, we do not boil the water, can we drink immediately?
No, you should ask the question, the water from underground, does it properly filtered? If without filtering, I will suggest you to use the water for the plant, for animal, but not for human body.
I see. Okay, if we have some kind of filter, say the company's filter, the device.
Yes.
Filter.
Of course, safe to drink.
Sorry?
Safe, very safe to drink.
Very safe, huh?
Yeah.
That means no need to boil.
Yeah, of course.
You can drink immediately after resonating.
Yes, without any delay.
Thank you.
Thank you.
Thank you.
You will be very happy.
Yeah, thank you.
Okay, last question, Dr. Gan. Antibacterial means kill all bacteria. So good bacteria as well in the intestine, right?
Yeah.
So Dr. Gan, did you hear the question? Antibacterial meaning kill all bacteria. So does it include
no, antibacterial doesn't mean that is for good bacteria. It's only for bad bacteria.
Okay. Okay, I hope that we have answered all your questions. And we shall end our Zoom session for tonight. Thank you everyone for attending and spend your precious time for these hours over in our Zoom. I hope to see you all next week again. Thank you very much, Dr. Gan, and good night, Dr. Gan.